Question 47 scenario. Physician decided cystotomy. Nurse explained disease and treatment alternatives. Patient showed acceptance by facial expression. Q. Best next step for nurse? Choices. A. Provide preoperative care. Take patient's signature. Inform physician of acceptance. Give patient chance to talk to identify needs. Step by step. Informed consent requires written signature after explanation. Facial expression is not enough. Answer. B. Take the signature of the patient. Question 48 scenario. 2-year-old child with travel history to lowland Ethiopia, high-grade fever, blood smear not available. Q. Most likely diagnosis? Choices. A. Malaria, measles, pneumonia, fever. Step by step. Lowland Ethiopia plus high fever plus no blood smear equals presumed malaria. Answer. A. Malaria. Question 49 scenario. Married woman with 5 children, works hard to meet family needs, husband doesn't support, comes late, slaps and kicks her. Q. Most likely type of violence? Choices. A. Economic abuse, sexual abuse, psychological abuse, physical abuse. Step by step. Slapping and kicking equals physical abuse. Answer. D. Physical abuse. Question 50 scenario. Woman using yuck for 6 months, lower abdominal pain, plus dyspareunia. Vaginal exam, uterine and cervical tenderness. Q. Priority nursing diagnosis? Choices. A. Risk for injury, risk for traumatic, risk for bleeding, risk for infection. Step by step. Yuck plus pain plus tenderness equals possible pelvic infection PID. Priority equals risk for infection. Answer. D. Risk for infection. Question 51 scenario. Researcher studied hypothesis. Frequent fruit or vegetable consumption protects against stomach cancer. Recruited 198 newly diagnosed stomach cancer patients and 396 without cancer. Asked about past year consumption. Q. Most likely study design? Choices. A. Ecological, case control, cross-sectional, cohort. Step by step. Started with cases cancer and controls no cancer. Looks back at exposure. That's case control study. Answer. B. Case control. Question 52 scenario. 4-year-old child, cough for 3 days, inspiratory stridor, barking cough. Q. Most likely diagnosis? Choices. A. Croup, pneumoniac, tonsillopharyngist, pulmonary TB. Barking cough plus inspiratory stridor equals croup-laryngotrachobison. Answer. A. Croup. Question 53 scenario. 24-year-old with osteomyelitis. Nurse taught about nutritional needs for amino acids to facilitate healing. Q. Most likely anticipated complication prevented? Choices. A. Protein deficiency, carbohydrate deficiency, vitamin deficiency, mineral deficiency. Step by step. Amino acids come from protein. Answer. A. Protein deficiency. Question 54 scenario. 43-year-old. Fever, fatigue, chest pain, sweats 2 weeks, tachycardia, productive cough, accessory muscle use. Q. Priority nursing diagnosis? Choices. A. Fluid volume deficit, ineffective airway clearance, fatigued, hyperthermia. Step by step. Accessory muscle use plus productive cough equals difficulty breathing. Airway clearance is priority. Answer. B. Ineffective airway clearance. Question 55 scenario. 36-year-old. Abdominal pain, persistent vomiting, distension 6 hours, high-pitched bowel sounds, visible peristaltic waves, tachycardia, decreased urine output. Q. Priority nursing intervention? Choices. A. Maintain NG tube to decompress bowel. Measure intake or output. C. Place in Fowler's position. Administer 4 fluids and electrolytes. Signs of bowel obstruction: high-pitched sounds, peristaltic waves, vomiting, distension. Priority equals decompression with NG tube. Answer. A. Maintain NG tube as prescribed to decompress bowel. Question 56 scenario. 44-year-old. Itching plus rashes, visible scratch lines, no info on self-care. Q. Priority nursing diagnosis? Choices. A. Disturbed body image, impaired skin integrity related to scratching, anxiety related to fear of death, deficient knowledge about disease process. Step by step. Visible scratch lines equals skin already impaired from scratching. Immediate physical problem equals skin integrity. Knowledge deficit is important, but not priority over active skin damage. Answer. B. Impaired skin integrity related to scratching. Question 57 scenario. 4-year-old on supplementary feeding. Weight for height 65%. No other comorbidity. Q. Interpretation of anthropometric measurement. Choices. A. Mild acute malnutrition, moderate acute malnutrition, severe acute malnutrition, severe chronic malnutrition. Step by step. Weight for height 65% equals severe acute malnutrition. 70 is severe. Answer. C. Severe acute malnutrition. Question 58 scenario. 48-year-old woman, loss of appetite, fatigue, progressive weight gain, feels cold in warm environment, hoarseness. Q. Most likely medical diagnosis. Choices. A. Graves' disease, thyroid storm, hypothyroidism, myxedema. Step by step. Weight gain, cold intolerance, hoarseness equals hypothyroidism. Myxedema is severe or complicated hypothyroidism. Answer. C. Hypothyroidism. Question 59 scenario. 45-year-old with acute renal failure, edema, difficulty breathing, 250 milliliters urine in 24 hours, serum creatinine 1.9 mg, or DL normal 0.6 minus 1.2. Q. Pathophysiological stage of renal failure? Choices. A. Oliguric phase of, diuretic phase, recovery phase, initiation phase, urine output 40-24 Hr equals oliguric phase. Answer. A. Oliguric phase. Question 60 scenario. 25-year-old on mechanical ventilator after car accident, eyes not open to any stimuli, incomprehensible sounds, abnormal flexion decorticate. Q. Out of consciousness using Glasgow Coma Scale. Choices. A. Stupors, somnolence, comatose, semi-conscious. Step by step. GCS. I equals 1 no opening. Verbal equals 2 incomprehensible sounds. Motor equals 3 abnormal flexion total equals 6. GCS A equals comatose. Answer. C. Comatose. Question 61 scenario. 30-year-old pregnant woman, first ANC, amniotic fluid index 24, fetal weight 10% gestational age, fetal heart rate 110, renal BP 90/60ths, diagnosed amniotic fluid disorder. Q. Best characteristic that led to diagnosis? Choices. A. Increased fetal weight, fetal heart rate 110 mg, amniotic fluid index normal 24D equals blood 5, pressure minus 24, OFI equals 24 is upper limit of normal, but in some protocols 20/25 is polyhydramnios. The direct measure of amniotic fluid disorder is OFI. Answer. C. Amniotic fluid index 24.